We talked about this in Chapter 1 when we talked about homeostatic mechanisms. We talked about the set point, negative feedback, and how our bodies have receptors that pick up this information, thermoreceptors when it comes to temperatures, sends the information to the hypothalamus if effectors respond. Heat production, when heat production is excessive, that is hyperthermia, the thermoreceptors send the information to the hypothalamus and it senses the blood temperature. The dermal blood vessels dilate, deeper tissues constrict. The heart will beat faster to circulate that blood faster. Sweat glands will produce sweat. And as this fluid changes from a liquid to a gas, evaporates from the skin, it draws the heat away from it and into the atmosphere. When our body drops below set point, the thermoreceptors pick up that information and sends it to the hypothalamus. It senses the temperature and the little danger signal goes up. The dermal blood vessels constrict. The sweat glands remain inactive. Skeletal muscles begin to contract slightly, involuntarily, as we shiver from the cold. And the result of the contraction of the muscles whenever they're doing work, heat is a byproduct of work, so it helps to warm up our body. Also, as discussed before, the blood vessels constrict and the blood is shunted from the extremities, especially in severe hypothermia. The body will shunt the blood to the core, to the trunk, where the vital organs are, to maintain the health of those vital organs. Skin color is due to the varying amounts of melanin. The melanin is produced by the melanocytes. The more melanin, the darker the color. There's various sizes of melanin granules, and the albinos lack melanin. So the amount of melanin determines skin color. Melanocytes produce protein pigment melanin. Melanin granules produced are engulfed by the keratinocytes. That is one of those keratinized skin cells. Melanin accumulates on the superficial side of the keratinocyte. On the superficial side, the surface closest to the environment and protects the nucleus and forms sort of a shield from UV radiation. So the more sun or sunlight exposure, it produces more melanin, so your skin darkens. The differences in skin color are due to activity of the melanocyte or melanin breakdown, not due to the number of melanocytes. Amount of the activity or melanin produced by those melanocytes, not the number of melanocytes. There are 3 pigments that can cause a change in skin color. Of course, melanin is number 1, keratin, and hemoglobin. Now, keratin comes from vegetables such as carrots and tomatoes. If you eat too many carrots, say you're on a diet, your skin can get an orange tint to it, much like the color of the skin of people who are jaundiced. And one way you can tell the difference is that a person who is jaundiced, the sclera, the white of the eye, will yellow, the skin turns orange color, but keratin just colors the skin and not the sclera in the eye, around the iris of the eye. The white of the eye will not change colors. If it's just pigment from keratin, you have to eat an awful lot of carrots to change the color of the skin. But if you're on a diet and you're eating a lot of carrots, or a child that likes carrots and eats a lot of carrots could have a little bit of orange tint to the skin. It is not produced by the skin. It's found in plants, and that gives the plant that orange color. Sunlight, again, UV radiation from sunlight lamp results in more production of more melanin and also X-rays. So a person undergoing radiation therapy may have some darkening of the skins around the area where they're radiating it. Low oxygen can cause the skin to become ashen or more gray color because of the lack of oxygen in the hemoglobin. When we look at blood later on, the red blood cells, the depression of the red blood cell that's in the center it has hemoglobin that carries oxygen, and if it's not carrying oxygen, it doesn't get the deep, dark red. Oxygenated blood, or I should say bright red, it gets more of a blue, dark red, almost blue color. But the lack of oxygen, cyanosis, causes the skin to become ashen or gray colored. Dilation of the dermal blood vessels, more red or pink. Constriction, the low oxygen or constriction of blood vessels cause it to become more ashen or gray color. Healing of cuts. The blood escapes from the dermal blood vessels, the damaged blood vessels, and forms a blood clot. And then the clot dries. The tissue fluid forms a scab that protects. Blood vessels branch. And fibroblasts. Fibroblasts are a particular type of cell that migrate to the area. They form fibers of connective tissues. The fibroblasts produce new connective tissue fibers. The skin is mostly healed when the scab sloughs off or comes off. The action of the fibroblast is the first thing that happens after a scab is formed. I'm going to repeat all that because it's important. Fibroblasts produce new connective tissue fibers. And when the skin is mostly healed, the scab sloughs off. And the action of fibroblasts is the first thing that happens after a scab is formed. Now, with large open wounds, granulations will also appear after the appearance of fibroblasts, and they will surround blood vessels and help to repair blood vessels. The healing of burns. A first-degree burn is a superficial partial thickness burn. It's only the epidermis that gets burned. It repairs in a few days to 2 weeks. There are no scars. A sunburn can be a first-degree burn. It's just a superficial partial thickness burn. Epidermis only, outermost layer of skin. A second-degree burn is a little more serious. The epidermis is involved in some of the upper dermis. Now, remember I said that keratin helps to toughen up the skin cells. It helps to make the skin cells more waterproof, helps us to keep our fluids inside of us so that we don't ooze our fluids. The epidermis of some of the upper dermis in a second-degree burn is burned away, so fluid can escape to the epidermis, forming blisters. Exposure to hot objects, liquids, flames, burning clothing can cause second-degree burns. New epidermis forms and usually completely recovers, and scars only occur if there's infection. This is also called a deep partial thickness burn. Deep partial thickness burn. The most serious is the 3rd-degree burn. It is the full thickness. It destroys the epidermis. It destroys the dermis, the accessory organs of the skin. It's called a full thickness burn. It causes extensive scars, and the skin becomes dry and leathery. It happens when there's immersion in very hot liquids, prolonged exposure to hot objects, flames, or corrosive materials. Now, an autograft, when they're doing skin graft, an autograft is from an unaffected area of the burn patient's body. Okay, so it's from oneself. Autograft, same person. A homograft comes from a cadaver, a donor. There are various skin substitutes they can use, and of course the 3rd-degree burn leaves extensive scars. When you are talking about burns, there is a system of rules of 9, so whenever you hear that a person has had a certain degree of their body, their burns are over 9% of their body, well, here's how that breaks down. So it's the rules of 9, just the anterior head. Anterior head would be 4.5. The trunk's fairly large, so it's 18%. Each leg is 9%. The arm is shorter, so the front part of the arm is 4.5% and 4.5%. The more percentage the body that's covered, the more serious the burns. The rules of 9 are used in treating burn patients to estimate the amount of burn surface area. Rules of 9 is used in treating burn patients to estimate the amount of burn surface area. So burns to the torso are pretty serious because the area of the torso is so large. I'm going to stop here before going to the next. As we turn the last model around, we have burn classification. This area is epidermis. This is the dermis and the subcutaneous layer, the hypodermis. We look at a 1st-degree burn, also called a partial thickness burn or superficial partial thickness burn. Superficial partial thickness. It involves only the epidermis. It heals in a few days to 2 weeks. A sunburn can fall under this category. Superficial partial thickness. Usually leaves no damage. The 2nd-degree burn is also called the deep partial thickness because it goes down into the dermis. Because it pretty much destroys the epidermis and goes down into the dermis, there is some oozing of fluids and blisters form. This is from exposure to hot objects, liquids, flames, and burning clothing. New epidermis will form, and it usually will completely recover unless there's an infection here. A severe sunburn can be a 2nd-degree burn. A deep partial thickness burn. The 3rd degree, the most serious type, you have the epidermis is completely destroyed and the good part of the dermis all the way down to the hypodermis or subcutaneous layer. So it is called a full thickness burn because it goes into the deep tissue. It destroys the epidermis, dermis, and all the accessory organs that are found here. Full thickness. There will be extensive scars. The skin will be leathery and dry because it's loss of these accessory organs. It's usually from immersion into hot liquids, prolonged exposure to hot objects, flames, and corrosive materials. Now here's the problem with this one. you have destroyed this tissue. And remember, this, especially the epidermis, is keratinized epithelial cells. That keratinized epithelial cells, they're tough and also water resistant. So you've lost that layer that is protecting you from losing your fluids. And so at third-degree burn, yes, it burns away that barrier to microorganisms, so infection is very much a concern. Also, loss of fluid, so dehydration, shock and dehydration should be treated immediately. Somebody who has received third-degree burn should have treatment for prevention of shock and water replacement, fluid replacement, because there will be a lot of loss of fluids because there's nothing to hold it in anymore. There's nothing to stop those microorganisms, so it's very serious. Usually there's going to be extensive scars. An autograft, remember, that is tissue that is collected in a healthy area, healthy skin on the person's body who received the burn. A homograft from a cadaver who has donated, is a donor. And then skin substitutes. And there will be extensive scars. The epidermis is destroyed, the dermis is destroyed, and the hypodermis, or the subcutaneous layer, is damaged.